Today, we're going to be talking about my pediatric and adolescent case study that will be over obsessive compulsive disorder, also known as OCD. OCD is a mental health condition that is characterized by anxiety, compulsions, and obsessions. Obsessions are anxiety inducing thoughts. Some obsession related thoughts can be about germs, illness, if things are where they're supposed to be, things that may be rude or wrong in that person's eyes, and colors and numbers that seem to have a special meaning. Compulsions are behaviors that individuals with OCD feel a strong pull to do. Compulsions are also called rituals. Some examples are feeling like you have to clean repeatedly, repeat words and phrases, rechecking to see if something is locked, touching or tapping things a certain way a certain number of times, doing things in a set way, or avoiding colors and numbers that may seem unlucky to that individual. Some considerations for treating the OCD patient would be being aware of germ-related OCD, show clean, packaged instruments and go over cleaning process of operatory if the patient requests, create a calm environment to reduce anxiety, and patient education may be needed, especially in cases of recession due to hard and overbrushing. Perfectionism may contribute to enamel erosion, gum bleeding, and recession in the OCD patient. Today, our patient is going to be Sarah Smith, that is a 14-year-old female with OCD. Sarah is currently a high school freshman in the 9th grade. The patient's mother and father are her guardians. Sarah enjoys collecting fun rocks and other items she finds in nature. Sarah is an avid artist and is an active member of her high school's art club. The patient loves her pet bunny Marshmallow and is an animal lover. The patient was diagnosed with OCD at age 11 after an onset of obsessions and compulsions when entering middle school. For her physical status, she is currently in good health. Some contraindications to therapy may be if the patient needs assurance that items like instruments, high-speed handpieces, and ultrasonic scalar inserts are sterilized. Show the patient the sterilization process and explain high standards of care that we have as medical professionals if needed. For the patient's mental status, she is currently doing well with her OCD symptoms managed. The patient previously struggled with germ OCD-related anxiety and had issues in the past with dental appointments. Therapy and medication have eased the patient's anxiety. The patient is intelligent, alert, and eager to learn. She was able to comprehend oral hygiene instructions and did not have vision or hearing issues. For her nutritional analysis, all of her meals were provided by her parents, and typically the patient does have 3 balanced meals daily. The patient does drink soda daily with lunch and dinner and also has ice cream for dessert every other night. The patient occasionally uses xylitol lozenges due to a recommendation from her dental hygienist to help with salivary flow. For her medications, OCD medications for adolescents are typically serotonin reuptake inhibitors, also called SRIs. These medications can help control symptoms but do not cure the disorder. Typically, some symptoms of OCD will remain even when the patient is medicated. These symptoms will just be less severe. OCD medications will take up to 3 months to see improvement in symptoms. Sarah is currently taking sertraline, which is also called Zoloft, and is an SRI. She takes 200 milligrams daily to help manage symptoms and has been taking this medication for the past 3 years and has found it to help minimize symptoms of OCD. Some dental considerations are xerostomia, anxiety, dizziness, dysphagia, and bruxism. The chief complaint we have today is that the patient is here for her regular 6-month cleaning. She's going to receive fluoride application and bite wing x-rays. This will be the patient's first prophylaxis appointment since getting braces. The patient's mother would appreciate having us go over OHI for braces to maintain the patient's good oral health. The patient has reported jaw pain from grinding her teeth at night as well. For our intra-extraoral examination, some findings were bilateral crepitation and subluxation, chapped lips, bilateral linea alba, slight white coating on the dorsal of the tongue, and tori on the hard palate. The patient presented with class 1 occlusion with a 4 mm overjet. The patient had slight blunting on the papillary of the mandibular anterior teeth, and there was generalized rolling present on the maxillary and mandibular posterior teeth. For her dental charting, 1 and 16 were found to be impacted, 17 and 32 were not present, and sealants were placed and intact on 2, 3, 14, 15, 18, 19, 30, and 31. There was slight crowding present on 22 through 27, and attrition present on 6 through 11 and 22 through 27 on the incisal edge. Braces, brackets, and wires were present on 2 through 15 and 18 through 31. For her periodontal chart, BOP was found on 7 posterior teeth interproximally. 11% of sites exhibited BOP mild plaque-induced gingivitis. Localized 4 mm pocketing was found on posterior teeth, and the patient had slight blunting on the papillary of the mandibular anterior teeth, and there was the generalized rolling present on the maxillary and mandibular posterior teeth. For her radiographic interpretation, 4 bite wings x-rays were taken and also a pan. Maxillary third molars were found to be impacted on x-rays and appear normal. Brackets and wires were present on x-ray images. No signs of decay were present, and all bone levels were healthy and within normal limits. For our periodontal risk assessment, the patient was currently at moderate risk of developing periodontal disease. This is due to the patient taking Zoloft, which can cause xerostomia, having OCD, supragingival presence of calculus, BOP on 11% of sites, and 4 mm pockets localized. The patient's good socioeconomic status, daily home care, healthy attachment levels, and adequate plaque biofilm control help the patient be less at risk for developing periodontal disease in the future. The patient needs regular assessments while home care habits are still forming as a teen. For the patient's caries risk assessment, she was overall at low risk for caries. The patient's medication Zoloft does cause xerostomia, but the patient has many protective factors in place to help reduce her risk of caries. The patient has fluoride exposure through fluoridated water, toothpaste, mouthwash, and fluoride varnish applications every 6 months. The patient regularly goes to the dentist and is an established patient of record. For the patient's oral hygiene status, her PHP score was a 1.5 in the good range. There was light supragingival calculus present on the lingual of mandibular anterior teeth. She was still noted as a calculus level A. There was localized areas of BOP and 4 mm pocketing on posterior teeth. The patient had braces placed 3 months prior. And currently the patient brushes twice daily with an Oral-B IO toothbrush, uses Listerine Total Care mouthwash once daily, and flosses with string floss and a threader 3 times weekly. For the patient's treatment, prophylaxis was performed by hand scaling and ultrasonic. No polishing was done due to brackets and wires. 5% sodium fluoride varnish was applied, and the patient was instructed to not eat or drink for the next 30 minutes. The patient was cooperative, and there was no issues communicating with her guardians. For OHI, the patient was shown how to floss with braces. The patient was educated on the importance of flossing and was sent home with a pack of floss threaders. She was instructed to use string floss every other day and to work towards nightly flossing. The patient was recommended to use a water flosser daily to help with keeping her mouth clean while she still has an orthodontic appliance. The patient was recommended a night guard after braces removal to help with bruxism and attrition linked to her medication, and the patient is on a 6-month recare. Here are my references. Thank you so much for everyone for listening.